Well, I want to start with a challenge. We learned recently that the Biden administration had failed to secure $5 billion, as we heard in the last segment. How, and I know you made very impassioned pleas for that funding, how does it hurt our response globally to the pandemic?
Well, I haven't given up yet, and neither has the Biden administration, but it is going to be extremely damaging if we do not have funding to continue past the summer in our global COVID-19 work. Stopping funding of COVID-19 will be damaging on a number of fronts. So first you have to think about how much we've accomplished. We have had a historic global vaccination campaign that has reached not just the highest income countries in the world, but also the upper middle income and lower middle income countries, to the point that even in Latin America, we're closing in at 80% fully vaccinated in those populations.
So that again, 80%?
80%
so
in there.
Impressive number.
On the other hand, less than 1% of vaccines, of the 10 billion vaccines that have gone out, have reached the low-income countries. So if you look at Africa as a continent, the vaccination rate, the full vaccination rate is just 16%. And that gap means that the variants that continue to roll and surge around the world, we have been successful in disconnecting cases from deaths, so that we've had surges of cases, but the surges of deaths have been much lower, and we have other tools in our arsenal like antiviral pills and rapid tests, and those simply have not reached those parts of the world. That is damaging because it's going to be harmful for health. It's damaging because it disrupts our supply chains. You know, the world is interconnected. The basic ingredients of everything from our own drugs to what we needed for our computers goes through Africa and other parts of the world that are affected. And so our supply chain shut down, inflation happens, and then our variants come out of those parts of the world. And every variant has come from abroad. Those surges have hurt us here at home. And so it is, I would argue, a health mistake, an economic mistake, an ethical mistake. It's also a geopolitical security mistake of epic proportions.